Today we will discuss about the sciatic foramen, greater sciatic foramen and lesser sciatic foramen. First of all, we know about the pelvic bone. It has three parts: the ilium, ischium, and the pubis. And there are several parts, but the most important parts is ischial spine, the iliac crest, the anterior superior iliac spine, and the posterior inferior and posterior superior iliac spine. Then we know about two ligaments, the sacrotuberous ligament and sacrospinous ligament, which converts the upper sciatic notch or greater sciatic notch into greater sciatic foramen and the lesser sciatic notch into lesser sciatic foramen. Discuss about the muscle which passes through the greater sciatic foramen, the piriformis muscle. It originates from the sacrum and insert into the greater trochanter of femur. Divides the greater sciatic foramen into two parts, the upper parts and lower parts. Now we know about the structures passing through the greater sciatic foramen. It has another name, gateway of gluteal region. So the greater sciatic foramen passes structures above the piriformis are supragluteal nerve and vessels, and structures below the piriformis are sciatic nerve, inferior gluteal vessel and nerves, pudendal nerve, posterior femoral cutaneous nerve, nerve proctor internus, quadratus femoris, lasers. The lesser sciatic foramen transmit tendon and nerves of obturator internus, pudendal nerve, and internal pudendal artery and vein. And we may know about a mnemonic to remember this name, which is POPS IQ. P for pudendal nerve, O for nerve to obturator internus, another P for posterior femoral cutaneous nerve, and S for sciatic nerve, I for inferior gluteal artery and nerve, Q for nerve to quadratus femoris. Now we see a figure which we discussed earlier. The structure passes through the greater sciatic foramen, and we see the piriformis. Some structure passes above the piriformis and some below the piriformis. Then we know about a syndrome which is called piriformis syndrome. We know the sciatic nerve passes below the piriformis muscle. If the nerve is compressed by piriformis due to any cause, it's called piriformis syndrome. Now we may see the definition. Piriformis syndrome causes pain or numbness in the butt, hip, and upper leg. It occurs when piriformis muscle press on the sciatic nerve. The condition may be caused by injury, swelling, and muscle spasm or scar tissue in the piriformis. So, Robinson first introduced the term piriformis syndrome. It may cause pain in sacroiliac joint, greater sciatic notch, and piriformis muscle that radiates down the limb and cause difficulty in walking. Thank you all.